Great. So what we're looking at today is an 8-year-old boy with pain that's waking him up at night. And we can see from these long axial T1 and proton density images that we have an abnormality at the head of the fourth metatarsal. This is hyperintense on fluid sensitive sequences and hypointense on T1 and has a linear configuration on T1 weighted images through the metatarsal head. And you can see it there. We can also see this well on sagittal images, and we want to assess the bone marrow edema here, but also we would like to see the articulation that this joint is not subluxing. We can also then go on to evaluate the short axis dimension to take a look at whether or not there is a plantar plate injury. So let's just blow that up as well. So what we're seeing is this hyperintense signal change. We're seeing the proper accessory collateral ligament as it comes to the flexor tendon, and this band here is our plantar plate. We can see as we round towards the tibial side, we also have the accessory and the proper collateral ligament. We can see that here. So what we're looking at altogether is a situation of Freiberg's infraction, and Freiberg's infraction basically is what they call an idiopathic osteochondrosis of the metatarsal heads. Most commonly, this is affecting the second and third metatarsal head, but it rarely can affect the fourth metatarsal head, as we can see here, and even the fifth. In fact, it can be bilateral in about 10% of cases, and it's actually more common in athletic females, male to female ratio equal to 1.5. And the fourth is the most common osteochondrosis, and it's the only osteochondrosis more common in females. This is actually a boy and not following the rules, but that's what we can see there. So this is Freiberg's infraction, and if you want to learn more about that, you can take a look at that on an AJ article that had a lot of great points to make on this subject, including that they feel that Freiberg's infraction, this metatarsal head, is a subchondral fracture. It occurs in adults just the same as it does in children with this chronic repetitive stress. As we can see, the fourth metatarsal head will impact the base of the proximal phalanx, and that is the etiology. There is an abnormal biomechanical stress of metatarsal purchase, and what we can see is that the metatarsal head will tunnel into the base of the proximal phalanx. There can be resultant plantar plate issues, and we can see the flattening that can occur there. In cases where the flattening occurs, the fissure that might actually occur along the cartilaginous surface can lead to a disruption of that epiphyseal vascular supply. This is the theory behind it. And that can evolve to ischemic bone necrosis. And there are actually 5 stages of this described, with progression or consolidation of the bony structures at any stage when it's fragmenting. And what stage it occurs in is what you will see later on. So if the impaction occurs early and that there is a fragmentation and a flattening, we may actually have remodeling and a flattened head later on in life. So this is Freiberg's infraction of the fourth metatarsal.